Within the home, the main device for delivering oxygen will be an oxygen concentrator. This is an example of a standard flow oxygen concentrator, which will go up to 5 litres, and this is an example of a high flow, which will go up to 9 litres. Within the home, the oxygen will be administered via 2 methods. One method may be an oxy mask, which is attached to the concentrator. The other will be nasal cannula or nasal specs, as they're known. There's 2 types. One is curved, and the curve goes towards the lungs. The other type has got a lip, and we will put that in the patient lip to lip, and we'll be using them shortly. When you arrive at the house, you need to ensure that the oxygen is prescribed. This will be on your domiciliary care medication instruction sheet. You will see from the first one that the patient is prescribed oxygen 2 litre via nasal cannula. So that will be for rest or activity. The second one, you will see oxygen 2 litres at rest via nasal cannula, and then oxygen 4 litres for activity via oxy mask. So that is for a patient who will be using 2 litres when they're sitting at rest or 4 litres for activity. So when you arrive at the house with a patient, you will carry out your normal infection control procedure. You will check the Cardex. You will gain the patient's consent to ensure they're happy for you to commence their oxygen if it's not already in place. The blue concentrator will be turned on at the wall. When we turn it on, you will hear a noise, an alarm, which will stop after a few seconds. And these lights will also light up, but they will also stop. If you turn it on and the alarm does not stop or the lights are on, you must phone the number on the bottom of the machine to report a fault. When you're about to use it, you must ensure the tubing is not kinked. So you unkink your tubing and ensure it is clean. We look at the nasal cannula. Are they clean? If they're not, we will wipe them with a damp cloth. So this patient is prescribed 2 litres of oxygen. So I'm going to turn the machine on. And you can see the alarm stopped and a green light is on to tell us it's functioning properly. It should already be set at 2 litres. You must, when this is on the floor, get down on your knees and be eye level. The middle of the line must be on the middle of the ball. So before you administer oxygen to the patient, you must ensure it's still set at the prescribed flow for this patient's 2 litres. So these nasal cannula are the lip to lip, and you will encourage independence with your patients. So if they're able to put it on themselves, they will do that. Otherwise, you will assist them. So put them into their nose, okay, up round their ears, and then tighten the little scarf tightening at the bottom. Not too tight, and keep an eye on their ears that their ears are not breaking. When the patient, every day these nasal cannula will be changed, and when the patient does not need the oxygen, it must be turned off and then removed. We cannot remove the oxygen and allow the oxygen to sit on top of material while the machine is still turned on. Each day the nasal cannula need cleaned, and each week they need changed. If you have moisturiser on your hands, you should wash them before you handle the oxygen equipment. Alcohol gel, as long as your hands have dried, that is fine. If the patient's nose is dry or the lips, they cannot use Vaseline under any circumstances. They must purchase some KY jelly through their chemist. If their nose is broken, the doctor can prescribe an appropriate treatment for that. So between the tubing and the machine, there will be what we call a fire break. This will be a white connector about this long with an arrow on it pointing what direction the oxygen will travel. There may also be one between your tubing and your nasal cannula. These must not be removed and should be always in place. This will prevent a fire from travelling up the tube. For some patients who need oxygen for mobilising or for activity, they will have small white cylinders within the home. These cylinders are kept upright at all times, and when they're ready for use, the valve will be unlocked to the left-hand side of the cylinder, and on the top there will be a regulator for you to adjust the flow, going from 1 to 15 litres depending on the prescription. On these cylinders they will also have a fire break and most likely nasal cannula. Some may have oxy masks. There will be a gauge at the front of the cylinder which will enable you to see how much is left. If these need replaced, yourself or the family can telephone the same number that is on your blue machine to order replacements. Within the client's notes, there also will be a care plan for domiciliary care or support workers in assisting a service user with oxygen. Some patients will have their drugs administered via nebuliser. This is what a typical nebuliser looks like. There's quite a number of varieties of nebulizers. Those that are loaned by the Trust will be labelled and will have what we call a bacterial filter attached. Private nebulizers will not. The nebuliser will come in 3 parts: an acorn, a mouthpiece and a set of tubing. Within the acorn there is a little valve. These 3 parts must be together for it to function properly. After each use, this should be taken apart and rinsed and dried and put back together ready for the next dose. And the mouthpiece sits on top. The tubing attaches at the bottom and then to the nebuliser. But like any drug, you must ensure it is prescribed on the domiciliary care medication instruction sheet, and it will be in section 3. And one example of a drug will be salbutamol. They will come, all nebuliser drugs will come in little vials like this here, plastic vials in a box, and they can be separated easily. You must ensure you have the right patient, the right time, the right route, the right drug and the right dose before you administer the drug. You must also ensure the drug you're administering is not expired, so check your expiry date. So we will take the acorn apart, open the vial and squeeze the drug in. We will then close the acorn and ask the patient to put the mouthpiece between their teeth. Some patients will have a mask attached, but most will have a mouthpiece. When you turn the machine on, you will see mist coming from the other end. I would strongly advise, if your patient is suspected or confirmed coronavirus 19, that you do not stay in the room while they're using their nebuliser. Ask your patient to turn the machine on themselves once you leave the room and ask them to turn it off before you return to the room. The nebuliser will take approximately 5 minutes to complete if there's only 1 ampule in it, and it will sound something like this. When it's finished, it will splutter and you will not see any mist coming from it. Like all procedures before you commence, you will follow appropriate infection control procedures and you will gain consent from your patient.